So today we're going to continue with the Mrcp basis consultation station, and I'm going to talk a bit about how we explain if the patient has a chronic disease. So let's move to our scenario. So you are a medical consultant in a rheumatology clinic. Mr. Johnson, a 52-year-old man, has recently been diagnosed with rheumatoid arthritis. The patient is seeking a clear understanding of his condition, the proposed management plan, and has several questions. So this is your scenario. So how are you going to approach this scenario? Again, I have divided into different sections. So remember, in the consultation station, practice and follow these sections. So first of all, you're going to introduce yourself. So greet Mr. Johnson warmly and maintaining a friendly and approachable demeanor. Something like this. Good morning, Mr. Johnson. Thank you for coming in today. I understand that you recently received a diagnosis of rheumatoid arthritis. I'm here to provide information, discuss your concerns, and outline our plan moving forward. So try to memorize these templates. This will be quite helpful when you are dealing with the real scenario in your exam. So once you have done your introduction, then you will move on to assess the patient understanding. So begin by asking Mr. Johnson what he understands about his diagnosis to gauge his current level of knowledge. So you can say something like this. Before we proceed, could you share what you currently know about rheumatoid arthritis? This will help me tailor our discussion to your specific needs. Okay, so first step is introduction, and second is assess the patient's understanding. Then you're going to move on and do the explanation of any chronic disease. In this case, we are focused on rheumatoid arthritis. So you provide a clear, jargon-free explanation of rheumatoid arthritis, covering the autoimmune nature, joint inflammation, and potential systemic effects. So you can say something like this. Rheumatoid arthritis is an autoimmune condition where the immune system mistakenly attacks the joints, leading to inflammation. Now, this inflammation can cause pain, swelling, and stiffness in the joints, particularly in the hands and feet. It's important to note that rheumatoid arthritis can also affect other parts of the body. This is just an example. Whatever explanation, simple explanation of the rheumatoid arthritis, which you are familiar or you think that you are confident with that one, you can say that. Important thing is just follow the different headings and different sections which I have introduced here. Then you're going to talk a bit about the confirmation of the diagnosis. So confirm the diagnosis and explain any specific findings from diagnostic test. So you can say like this: based on your symptoms and the results of the diagnostic test, we have confirmed the diagnosis of rheumatoid arthritis. And these tests help us understand the severity and extent of joint involvement. Okay. And then you will move on and talk briefly about your management plan. So outline the proposed management plan, including the medications, lifestyle modifications, and the importance of regular follow-up. Now, let's discuss how we can manage your rheumatoid arthritis. Typically, treatment involves a combination of medications to control inflammation, such as disease-modifying anti-rheumatic drugs. We'll also explore lifestyle modifications and the importance of regular follow-ups to monitor your progress. So you're going to give some summary of the management plan. Then you're going to address the any concerns. So going to inquire about any specific concerns or questions Mr. Johnson's may have about the proposed management plan. So something along the lines. Before we proceed further, do you have any specific concerns or questions about the proposed management plan? Your input is crucial in tailoring our approach to your individual needs. So here the maybe you are giving the opportunity so the patient will ask some questions. So just be confident and just answer the questions in a simple manner, which is use the simple language, jargon free, so that the patient can understand it. You will move on and talk about the side effects of the medicines and monitoring. So, discuss the potential side effects of medications and the importance of regular monitoring to ensure the most effective and safest treatment. So, I want to ensure you are well informed about potential side effects of medications. We will closely monitor your response and make adjustments as needed to achieve the best possible outcomes with minimal risk. Okay. Going to briefly talk about the lifestyle recommendations as well. So, provide the guidance on lifestyle changes such as exercise, joint protection, and the role of a balanced diet. So, you can say something like this: in addition to medications, lifestyle plays a significant role. Regular, gentle exercises, joint protection strategies, and maintaining a balanced diet can positively impact your overall well being. And finally, answering any questions. So, encourage Mr. Johnson to ask any questions or seek clarifications on any aspect of the diagnosis or management plan. Now, again, you're going to, once you have discussed about the lifestyle recommendations or the medicine, again, you give another chance to the patient so that if they have any question, they can ask now. So now I'd like to open the floor to you. Feel free to ask any questions or seek clarification or anything we discussed. Your understanding and comfort with the plan are vital. Okay, so here also the patient will ask you some questions, so you have to answer these questions. This session is 10 minutes, and as you know, there is no examiner interaction. So, but try to cover all these points within 10 minutes. And finally, going to do the closing. So, in closing, we just summarize the key points, express the ongoing support, and schedule a follow-up appointment. So, you can say, to summarize, we have a comprehensive plan in place to manage your rheumatoid arthritis. If any question arises after today, don't hesitate to reach out. We will schedule a follow-up appointment to monitor your progress and make any necessary adjustment. Thank you for entrusting us with your care, Mr. Johnson. So here you are giving your follow-up appointment also, and also encouraging the patient to, if they want to clarify anything, they can always clarify it in the next appointment. You can also suggest the patient to write down any questions, and they can put in the next follow-up appointment. So in this MRCP basis consultation scenario, the approach emphasizes clear communication, patient management, and addressing individual concern to ensure a collaborative and informed management plan for rheumatoid arthritis. So just follow the format. For any case, you can apply this format, and it will be quite easy for you to go on with this consultation session. Thank you very much, and I'll see you in my next presentation.